For Medicare beneficiaries to make changes to their plans during the annual enrollment period. After December 7th, though, anyone who hasn't updated their coverage may be stuck with a plan that could have higher costs or reduced benefits. Experts are urging people to review their options right now to make sure they have the coverage they need for next year. So joining me now is the founder of Green Insurance Agency, Bill Green. Bill, thanks for being with us this morning.
Thank you.
All right, so Bill, we know that October, some plans going away as a couple of months ago. So if someone didn't make a change, what happens? What can they still do right now?
So if they don't do anything at all, going into next year, they'll at the very least have no prescription drug coverage. That's if they had a drug plan. If they had a Medicare Advantage plan and they go next year, they have no drug coverage, they're back on original Medicare, which has an unlimited 20%. There's no max out of pocket. But also it gives them an opportunity to go into a paid plan with very little out of pocket with no health questions. But so for that, they actually have till the end of February to make a choice, but they should do it before the end of the year if at all possible.
For sure. We know inflation is hitting everywhere. That was a factor. So how did it affect Medicare plans through all of that?
So we've seen probably half of the plans cost go up, especially in the PPO plans. We've seen copays go up kind of across the board, out-of-pockets go up. Some plans have pulled back on their extra benefits like the dental vision. And then of course, Medicare supplements, the paid plans. We're seeing some plans have as much as a 17% rate increase in January.
One of the big talkers that's happening is recently Ascension sent out some communication that they're in negotiations right now with Aetna to renew their Medicare contract. So what could that mean for different patients no matter who their coverage is through?
So it's really affecting Aetna at this point, but this time last year we had Florida Blue went through the whole same process. It didn't completely get worked out with them. So if they actually have till the end of January to make that decision, if it gets to that point, they might not be able to see their Ascension doctors anymore.
Timing is very interesting with all of this. So how are people affected by this, especially if people end up missing that deadline tomorrow? What other options might be available for them?
So we've gotten lots of calls about that this week. And so there's different time periods to enroll depending on some situation. If they lost their plan or they qualify for some other special enrollment period, we can still even make a plan change through the rest of this year and into next year.
You kind of alluded to that too, but what kind of options do people have if they don't go through it during the typical enrollment period?
So the annual enrollment is what we're in right now. It's what ends tomorrow, December 7th. And then actually starting in January through March, there's what's called the open enrollment period. If someone doesn't make a plan change or they missed it or they just want to make another plan change, they can do it then. And then there are many what are called special enrollment periods where people can change throughout the year.
All right, and so for other advice, where should people go, especially if they're not listening to this interview now or if they forgot something and they didn't have access to this interview? What resources are available for people to kind of get brushed up in understanding what they need to do and what options are available? So
the government has their website, medicare.gov. It's not the easiest to navigate. What I would say is give us a call at Green Insurance or come visit us. We'll walk you through all the plans that are out there. We'll help you find the plan that has your doctor's network, your medicines covered well. That's what we're here for.
Bill, thanks so much for your time and for the information too.
Thanks.
All right, more of the morning show is coming up next.